Welcome to this case review. Today we are looking at the lasting effects of the polio virus on the adult spine. Let's start with the cervical spine MRI, and as you can see on this axial T2 image at the level of C6 you can see very distinct symmetrical signal changes anteriorly in the spinal cord gray matter. This is the classic all-eye appearance, representing the permanent loss of anterior horn motor neurons. Now look at the sagittal view, where you can appreciate the same signal changes anteriorly in the spinal cord. On the thoracic sagittal section, you can see the profound atrophy in the spinal thoracic cord. The entire cord is visibly thinned out as a chronic result of the extensive motor neuron destruction. Moving down to the lumbar spine, we can see dramatic downstream effects of this motor neuron loss on the musculoskeletal system. Look closely at the paraspinal muscles right here, especially the erector spine muscles and psoas muscles. Those as you can see, show profound fatty replacement, fatty atrophy. And this isn't just normal aging, this is severe fatty atrophy caused by decades of chronic irreversible denervation from the initial polio infection. I would like to use this opportunity to show the signal patterns in spine that are geographical and characteristic for some diseases. These are general patterns that you should keep in mind. So diseases like ATM, transverse myelitis, NMO and ADEM, they cause diffuse edema centrally in the spinal cord, while MS changes are more asymmetrical. They can be almost everywhere, mostly dorsally, and often quite in the periphery part of the spinal cord. Very characteristic changes we see in case of vitamin B12 deficiency, which is showing like a inverted V letter in the posterior tracts that is rather characteristic as high signal intensity in the posterior part of the spinal cord. And the case that we had today of the polio with anterior all eyes bilaterally, and finally we can see the anterior spinal artery infarction. If it's acute, you see the edema. If it is old, we see gliosis and atrophy, but it is located anteriorly. Sometimes it's like bifocal, it is sparing the posterior parts because it has a different blood supply. Thanks for watching. Don't forget to like and subscribe, and I will see you in the next one.